Well, good afternoon and welcome to the Small Business Briefing. It is Monday, November 29th. I'm Rob Fowler with SBAM, and Brian Calley, president of SBAM, is co-host. And as it has been for some time, this briefing is brought to you by Marana Group, a data documents and distribution services company. You can find out more at maranagroup.com. Brian, we actually we've got a lot to talk about today. Since the beginning of this pandemic, we have never taken a week off from our briefings, and we did that last week, partly because you and I were both out of town, and it seemed like a decent time to do it with the Thanksgiving holiday. But a lot happened in this past week, so we got some catch up to do.
We do. In fact, there's a lot of new factors out there right now, and a lot of action both in the legal world, but also with disease spread, hospitals filling up, and then you put on top of that all the federal policies that we're following, and some movement in Congress right before Thanksgiving. So yeah, lots to cover. Things are certainly not settling down quite yet, but I think that we're starting to get a clearer picture of what this for the Midwest. I mean, this kind of slow moving wave that we've seen happening over really since last summer in Michigan has kind of come to a head now, to where it's a much bigger concern with the type of hospitalization numbers that we're starting to see.
Yeah, well, let's jump in. Actually, there's a new word in our lexicon now. It's Omicron, a new variant of the virus, which could be vaccine resistant, could be resistant to those who have natural immunity. The World Health Organization is at least beginning to say we should watch for that. As far as we know, it has not made its way to the United States yet, but I think people are expecting it will. What do you make of that? And it's Data Monday, and maybe we take a look at what is happening in Michigan.
Yeah, well, let's go ahead and start with the data and the charts, and then we'll kind of launch from there into the discussion on the new variant, that was recently identified, Omicron, and then why this might be a little bit different. This is not the first variant of interest that we've seen, but the Delta variant, which is of course now very well known to everybody, started out as a variant of interest. So, but there are 7 others that really haven't made this kind of status of taking over. So, we'll talk a little bit about what makes this different. But first, let's take a look around the world and what's happening. You'll see that Europe kind of leading the way in terms of increased infections, and the United States and Canada here you'll see had come down. Just looking at the last 90 days and most of these charts here, it's good for looking at peaks and whether we've hit new highs and that sort of thing, but there's so much data going back now almost 2 years that I feel like it really distorts the ups and the downs when you crunch it in to fit it on one screen. So most of these slides, we're just going to look at the last 90 days. You can see the recent trends. Now, the other thing I want to point out here, though, is that I think that with the U.S. and Europe, the two that show higher, I think that disease surveillance is more complete and truthful in these areas as compared to some other parts of the world. So let's see if we can get this to advance. Looking at the United States, you'll see there's a new the way that this data source separates things out. They always put the state with the highest on its own, and that happens to be Michigan right now. It's been a little while since, as of this briefing, we don't have the new numbers for over the weekend, the holiday weekend for Michigan, so don't have a good sense for what to expect during that time period. But as you look around the country, you'll see that the Midwest is the highest generally, but Michigan is quite a bit higher than the rest of the Midwest. But kind of a strange looking line there. As you see, it's it looks like maybe it's leveled off, and if it wasn't for the fact that we're in the middle of a holiday season, I would believe that more. Looking at some other information, this is across the country here. the rate of infections, and that's what the average daily cases among unvaccinated during this this wave, you see it's pretty, pretty high, and this is the vaccinated. So people who are vaccinated can, of course, as we all know well by now, it's still possible that they get the COVID virus, but as you can see, the rate at which you get is much lower. What's more pronounced though is deaths. So you see, again, especially among the very elderly that have extremely weak immune systems, the fully vaccinated versus unvaccinated during this wave, the mortality rate 13 times as high. I wanted to point this out mainly because, as we have been and will be even more so very opposed to the idea of the government saying who our businesses can and can't hire. In other words, opposed to vaccine mandates. This doesn't change the fact that the data shows that vaccinations are highly effective, and I think the aggregate data here is just so compelling. Now, in looking at the Michigan's case levels, again, just the last 90 days, you see this kind of slow motion wave that was happening, or slow motion increase, and that seemed like it, went down a little bit, leveled off. Remember we talked about that time? It seemed like maybe it was going down, and maybe we were going to escape a big wave, and then it jumped up. But looking at the fact that we're in a holiday period and people don't necessarily get tested as much, looking at the hospitalization, you'll see that trend looks a lot more stable in terms of increasing. It might be actually leveling off a little bit now. This is about the level that it leveled off in the last two waves, 4,000 inpatients across the state. That was about as high as it has gotten in the last two times, the last two waves that hit. And then I thought I'd just take a look at that kind of our sister state, if you will, in Minnesota. And look, I want you to look at this part of the graph right here, just this most recent part of the graph, compared to Michigan, Minnesota, pretty similar. So, and then if you look at hospitalization in Minnesota, you'll see that it's kind of leveled off, still going up slowly. Smaller state, total of 1,500, so lower definitely than Michigan overall, but in terms of the trend, pretty similar. I looked at a couple other places. I didn't do the slides on it, but just looking at some other places around the country, there's a new lowest in the country. Guess what that is? Florida. And it just shows you that, like last summer when Florida had the highest numbers, there were people with political agendas that said, well, look, Florida is taking a different approach to the pandemic, and so look, they're being irresponsible. The numbers are really high, and now theirs are the lowest, and now Michigan's are the highest. And here's the thing: is there's so much about the spread of disease that is just outside of the direct control of individual government policies. It really is about individual choices that people make on a daily basis. And the data shows that the really a great way to protect yourself is our vaccinations. We know that the transmissibility of the Delta variant is multiples higher than the original. So it was way easier to not get the coronavirus in 2020 as compared to 2021 because of the transmissibility. And with this new variant of Omicron, that it's in a, there's this question about its transmissibility and whether or not it's higher, maybe, some early indications it might be actually higher, but not necessarily more severe than what we've been dealing with here in 2021.
So you just mentioned this, but the sort of backdrop for this both new variant and spiking numbers again is a fight over a vaccine mandate, and we occupy some kind of unique space, and that is we are pro-vaccine. The numbers you just showed are compelling, and anti-mandate. We've always been anti-mandate. The government telling businesses how to run their business and who to hire and those sort of things. So we're in a unique position. But right now, the federal government's being held back from implementing a mandate, but the Biden administration intends for that vaccine mandate to go forward.
They do, and they've announced that they're taking it all the way through the legal process. So the cases have all been consolidated into the Sixth Circuit Court of Appeals. By the way, SBAM has submitted an amicus brief. Now it's whether or not they accept it or consider any of the arguments is yet to be determined. They consolidated all these cases from all over the country into the Sixth Circuit. That's the circuit that Michigan is in. So it was important, I think, for Michigan for there to be Michigan voices that were present, and especially voices that were making the small business case. People look at it and say, well, it's just 100 employees or more. That doesn't affect small business. Well, guess what? There are a lot of small businesses that have more than 100 employees. In fact, a lot of restaurants, like an individual restaurant, it wouldn't be unusual for them to have 100 or so employees. So a traditional small business, many caught up in this, but also small businesses rely on logistical systems all around the world and supply chains that are made up of many larger businesses. So the idea that the worker shortage could impact both the direct employment of some small businesses, but also the operations of many more small businesses. But then there's also just the philosophical opposition to the government setting or dictating the terms of employment. And that is something, a long standing position of the Small Business Association of Michigan, is that small business owners ought to set the terms of employment for their businesses. And they will either get employees or not get employees based on those terms that they set. But they're the ones who ought to be in charge of deciding who gets to work at their businesses. And so this mandate is just the latest example of government intrusion on those rights. And it's something that we think is really important to defend, that regardless of the situation, that government doesn't know better than the small business owner on who the right fit is to fill their own positions.
Well, and another sort of backdrop for this conversation is our hospitals. Some of our hospitals are at capacity, some are near capacity. The Department of Defense has agreed to deploy 2 teams of doctors and nurses into Michigan. That takes us back to the peak days earlier, which was a time when restrictions came onto businesses. That's the trigger that we always look for. What are the policymakers? What's the governor's office thinking about these spiking numbers?
Yeah, and we do see definitely hospitals at or near capacity. Around 4,000 COVID inpatients means that the hospitals are going to be very crowded. Some hospitals literally at 100% capacity. The state had requested, or the hospitals had requested, that the federal government, the military, actually send some of their medical personnel to help out in hospitals. They have sent a few teams of 22 each that are in one hospital in Southeast Michigan, one in West Michigan. There are rural hospitals in Northern Michigan also that are really under the gun right now as well and need some help. Now, it's in the context of COVID, but I want to make sure that people understand that it's also, there's a big worker shortage in hospitals, just like you see in all these other in all of these other industries. You definitely see it in hospitals, especially among nurses. And so when you have you have these policies, say, well, it might make sense to have a policy, you got to be vaccinated to work at a hospital. But if you already have a worker shortage, that in Sault Ste. Marie, for example, their hospital has a 25% vacancy rate in their nurses. So the idea of losing any nurses at all under those type of circumstances is really difficult. So you put a worker shortage on top of just a year and a half or almost 2 years now of just really difficult work in hospitals. In other words, the staff has been heavily taxed, and then and when I say taxed, I mean worked hard over a long period of time without any real breaks or rests, and then you put on top of that a new wave and more hospital inpatient experience, and so that led to this request, and now at least some have been granted some additional help from the military personnel, which I know will go a long way. I mean, it's for I think I read that it was 42 teams of 22 or 44 total so far, and some other requests that are pending. Frankly, that's not that many, but like I said, when you're this short on personnel and staffing, well, every little bit helps.
Yeah. Well, we'll certainly keep an eye on this. This is those are, as we said, the sort of policy triggers that the Michigan Department of Health and Human Services and the governor's office will be looking at. Let's another sort of I don't know, result, I guess, of the pandemic is the Michigan Unemployment Agency sent a bunch of federal money out that really wasn't appropriate. And it has resulted, and there was almost blanket, oops, you know, we goofed up, but we're not going to ask you to pay the money back. But there are some that they're asking for repayment, and it's resulted in a surge in appeals, people appealing the request to have, in some cases, tens of thousands of dollars repaid to the Unemployment Insurance Agency.
Yeah, there are a lot of small business owners that it made more sense for them to take the federal unemployment benefit as opposed to the Paycheck Protection Program. So if kind of put ourselves back in the mindset when there's some businesses, especially those that sole proprietors, it may have made sense for them to take the unemployment insurance benefit as opposed to Paycheck Protection Program. And in those cases, when the state put out criteria that was incorrect, and so in good faith, people applied for and received over a very long period of time this benefit. Now the state comes back and says, hey, you know, you owe thousands, some cases tens of thousands of dollars back. There are literally thousands of those cases, and so it's caused quite a stir among those who are impacted, as you might imagine. A lot of appeals that are happening. There's an administrative law process, or these administrative law judges within the state that considers these cases before you go to like a regular court. And I was reading where one of those dockets has 4,500 cases in front of it, which is way more than could possibly ever handle in any kind of timely fashion. So the state will have to make some adjustments to deal with and consider this, but it's really put, especially in terms of our membership, some of the sole proprietors in a really difficult spot. And then at the same time, the state's got this backdrop of the embarrassment of all the improper payments, all the fraud that happened at this, and so they want to make sure they catch all the fraud, but also not put undue hardship on people that acted in good faith. So it will take, I think it's going to take them a long time. The saga of the Unemployment Insurance Agency it continues, but I think it's a cautionary tale of what happens when, for the sake of expediency, you take the quality control and the fraud prevention steps out of the process, and so it's really put Michigan in a difficult position, and the people that benefited from the service in an even more difficult position as they try to sort out, at the end of the day, what to do with all of the mistakes that happened over that last year and a half.
Yep. You know, one of the other issues we've been keeping an eye on, we've been talking about inflation, sort of generally, gas prices more specifically, and in with that as a backdrop, there's this conversation about Line 5, so-called Line 5. It's Enbridge's line that comes from Canada down into the United States, and it sits at the bottom of the Mackinac Straits. And there are those who would like to just shut it down right now, and the governor's office and the attorney general's office among those. Now the White House has gotten involved, and apparently a study is being done, or at least that's what we're told, about Line 5.
Yeah, so what's happened here is, as the challenge went from kind of the state to the federal government. Remember, we talked in a previous briefing that Canada invoked a treaty, which put it into kind of federal jurisdiction. And that's where it belongs, because this line goes through multiple states and multiple countries. And it is subject to the terms of a treaty. So the issue is now where it belongs in federal jurisdiction. The White House previously had indicated a study was being done to determine the impacts of Line 5, and it was then the White House clarified it afterward. That sounded like a little bit of backtracking, like, hey, this is just the regular review that the Army Corps of Engineers does. If that's the case, then I think that it's a foregone conclusion that it will be determined that this line is very, very important for energy production. What makes it more interesting, and why I think the clarification came from the White House that, hey, nothing to see here. This is just the regular Army Corps of Engineers process. We're not doing anything special or questioning the legitimacy of the line. Is the fact that gas prices are so high, and the president had negotiated with some other countries to do a coordinated release of strategic reserves. But it always sounds like a lot when they talk about the strategic reserves, but the amount that they're releasing is for the United States 3 to 5 days worth of normal usage. And in OPEC, the kind of oligopoly of countries that control a lot of the world oil supply they could make adjustments in their supply short term to negate any impact from it. It really isn't a good long-term strategy to release these reserves. It's not likely to have a big impact, at least not over the long term. But what it does do is it complicates this the arguing that happens over Keystone Pipeline and Line 5 in terms of domestic or North American produced energy. And while undeniably there is a transition away from fossil fuels in a lot of different aspects of energy, and that will continue, it will also be some time. Right, it's accelerating. We're seeing electrification of things happen faster than maybe what it looked like it would 10 years ago. But still, right now in November of 2021, there's still a need for some of these types of fuels, and it really is dampening the economy and contributing to the overall inflation trouble. So I think really it's why the White House wants to kind of downplay this study that was before kind of heralded as some kind of inquisition to just being something that's a normal process of reviewing. And it tells me that they're not really interested in getting into a discussion about reducing domestic production of energy, at least not right now.
So one of the other things that gets caught up in this conversation about inflation is, the federal policy and federal spending in particular. So when we last left, Build Back Better had not yet passed the House, and Build Back Better is the multi-trillion-dollar investment by the federal government in human infrastructure, is the term used early on. Little action happened while we were gone on Build Back Better.
There was a bill, a version of it, about half as big as the originally proposed bill that squeaked by in the House of Representatives. So it just passed very narrowly. They did add back in the House of Representatives a mandatory paid leave benefit that appears to be dead on arrival in the Senate. But here's the thing that really bothered me the most, other than just the overall kind of extra federal spending contributing to inflation. This question was whether or not it was paid for. And the Congressional Budget Office is really the gold standard. Whatever the law says to a T, they are going to do their best to estimate the cost. But what Congress can do is they can manipulate the way the policies work, knowing that the Congressional Budget Office has to look at it exactly as written, not how it'll practically work. And so in this case, what they did is they designed the bill so it front-end loaded spending and assumed that after a certain number of years that the new program and new spending would go away. They back-end loaded the revenue where they said, okay, in the next 10 years, here's what's going to happen. And in terms of spending, here's what's going to happen in terms of taxing to raise money. And they did it such that over a 10-year period, it looked like it was only modestly contributing to the deficit. When and we all know in the real world that when you put a new benefit out there, it doesn't just end when they say it's going to end. It will be extended. It's just like there are only a handful of examples of federal programs that have ever been, in terms of broad social programs, that have ever been discontinued, and those were the ones that frankly just didn't work, and just mechanically didn't work, and so they did something else instead of it. So in other words, they're usually replaced with something else. So the idea that the spending ends halfway through this 10-year period, I think was a farce, just to be blunt about it. So the concern about deficit spending and the contributing to inflation is very, very real, and we're very disappointed to see that it still passed Congress, and it did right along party lines. There are a few Democrats that voted no on it. Here in Michigan, all of our congressional delegation.
Yes.
Yeah, I'm sorry. All the Democrats voted yes. The Republicans voted no. Nationally, there were a couple of Democrats that voted no also, but generally along party lines. And when you're doing something this big, I know it's hard to find common ground or compromise, but in 2020 it happened. All the big bills that went through had, you had more of the most conservative and the most liberal voted no, but the center came together and made it happen. That's just not happening this year.
Yeah. Well, again, that's something we'll continue to keep an eye on for this briefing. It has to make its way through the Senate. We've talked about a couple of senators are standing firmly against the big number of federal spending, but this was intended to appease them a little bit. And so the question, call me cynical, but the trickery that's involved in this, I got to think the senators who are worried about the numbers would see right through it. So we'll see.
Right. Yeah, no, I think so. And I forgot to mention one thing about Omicron earlier when we were talking about this new variant and what makes it different, because there are other variants of interest that are out there. And in this case, though, why this one has kind of risen up, partly because it's got an unusual name. And, I really do think media kind of latches on it to names sometimes. But there's and it's kind of puts it out there. But there are a few differences that have put this higher on the radar screen. And but there's not a lot known yet. First is that in a country, in South Africa, it appears to be the dominant strain. So in other cases, when you would discover a new variant, you would normally see it kind of show up and something else is dominant, and it's not dominant anywhere, but it kind of gradually grows. In this case, in South Africa, it became the dominant strain, and almost without a lot of notice. And then all of a sudden it's like, whoa. And then showed up in a bunch of other countries, most of which had traveled from Africa. So as of today, the United States is putting in a travel ban to 8 different countries in Africa. That won't stop it. It's already spread around in different places. So the questions are, is it more severe, or is it more transmissible? And does it escape immunity? And we don't know those answers yet. It looks, early indications are that it's not more severe, and that it may be more transmissible. But I would caution that the population, most of the population that have had this variant so far, and it's how these things normally spread, are among younger people. So the impact that it has among older people, and its ability to escape or evade immunity from a previous infection or from the vaccines, almost nothing is known about that. But within 2 or 3 weeks, we will know a lot better. So expect much more to come on this, but it's just one of these issues that they'll look at. The 4 main things they're looking at right now: transmissibility, severity of the illness that comes from a vaccine efficacy. So it's ability to reinfect, and then I guess throw in there as well natural immunity, reinfection rates, and then also therapeutic efficacy. Because remember, there are other therapeutics out there, antiviral pills and so forth. So those are the items that they're studying right now. It's probably going to be 2 to 3 weeks before we know a lot.
All right, we've got about 1 more minute left. Let's sneak in one other issue. We've talked a little bit about the governor has sort of reversed a policy called Prevailing Wage, which is essentially for state construction projects, it would require a union wage. And there is while we fully expect this is going to be contested, the state has begun to move on something that suggests that they intend to follow through on this policy.
So what they've started to do are surveys of union wages and this is how prevailing wage works. They survey and determine an average union wage. So they only survey union jobs, but average union wage for certain functions, and then they apply that to contracts. So if you bid on a government contract, you have to agree for these different functions to pay these prevailing union wages, and so that surveying has begun. This, I fully expect, the fact that Michigan has repealed its prevailing wage law did a few years ago, that it'll get challenged. But right now, because it hasn't actually been put into a bid yet, they're just doing the surveying now. It hasn't been challenged because I don't think there's really anything to challenge yet. But rest assured that this will definitely be something that we cover a lot in the future.
All right, that's our briefing for Monday, November 29th. Thanks for joining us. We'll be back here on Thursday with the full briefing then. We'll see you Thursday.
See everybody on Thursday.